On the pediatric floor of Jamshoro Regional Hospital, children are being treated for severe malnutrition. Their weight is much less than it should for their age. If left untreated, they risk being stunted in their growth, a condition which affects 40% of children under the age of 5 in Pakistan.
This baby was not breastfed properly. She was breastfed for only 2 months and then fed goat's milk. She is 11 months old. Her weight is 3 kilograms, which corresponds to her birth weight. She has no muscle mass. The ribs have become very prominent and the skin is loose and wrinkled, meaning there is no more fat in the body due to malnutrition. The fat has dissolved.
This child is looked after by her aunt because her mother recently gave birth to another child.
We are poor and we cannot afford to feed our children. Her father is the only one who works. He has to take care of 8 children, his wife and me. And with inflation, it's really difficult for him to provide for everyone. Some days we eat well, and other days we're hungry.
More than 2/3 of Pakistan's children experience stunting. The consequences, which include physical and mental delays, can be irreversible if not addressed before the age of 2.
Compared to healthy babies, these babies' reflexes are slow, their growth is delayed, and they're not able to sit or talk. This is a delay in growth due to a poor diet. Even though we treat them, in many cases when the children return home, they are not fed properly and become malnourished again, forcing them to come back here.
The province of Sindh has the highest number of malnourished children in the country. Most of the inhabitants of this village are undernourished, like Mohabbat and his wife.
This is the pantry where we keep our food. It's empty. We only have sugar, no flour. For tonight, I will buy rice from the store and ask them for a loan, even if I already have debt to pay off.
The couple experienced stunted growth as children, and now they suffer the consequences such as physical weakness and decreased productivity.
We only eat once a day in the evening. There's nothing left to eat in the house. My job is physically demanding, and I also have to fetch water from outside the village. I have aches. I feel very tired, and I have to take breaks after each physical exertion.
Nutrition is essential to combat stunted growth, and so is hygiene. In this village, like many others in Sindh, there are no toilets or access to sanitation.
There are no toilets in the village. There is no sewage system. This is the place where we relieve ourselves. It's open air without a roof. We are poor. We don't have the money to feed ourselves. How could we afford a toilet? No NGO or government representative has come to help us.
Even big cities like Karachi are not spared from malnutrition and its consequences. Thousands of families are plunged into extreme poverty. Dadi Motio is overwhelmed by the health problems of her children.
He constantly has diarrhea. We can't afford to give him suitable food. He's 3 years old, and look at his state.
Even though she lives in the city, she feels isolated and abandoned by the state.
When we go to the doctor, he tells us that he just has a fever. We can't give him antibiotics because he's too weak. We give him some medicine and he feels better for a few days, but then he gets worse again.
She makes and sells brooms along with her husband and earns less than €3 per day, not enough to meet their needs.
My daughter can't walk properly. She needs to hold someone's hand. She's too weak and her lung muscles have not developed. The doctor said she needs a weekly injection to get better. It costs 400 Pakistani rupees per injection, but we can't afford it. This is my son. He has constant leg pain and frequently takes medicine for it.
The economic ramifications of undernutrition totals up to $7.6 billion annually for Pakistan, a nearly 3% loss in GDP.
Stunted growth in children under 5, combined with poor education for girls and not meeting basic healthcare needs, these factors drag down the growth and development of the country. I don't see Pakistan having quick and sustained development over decades without progress being made in these areas.
For several years, the rate of growth stunting in Pakistan has been one of the highest in the world. The government's effort to tackle it remain insufficient.